Hi, Shalene Giles with FIG, bringing Wisdom Wednesday to you. Our theme today is chronology. If we've reviewed the records, now we're ready to begin a chronology. A chronology or a summary depends on what type of report that you're creating. Typically in a life care plan, we do see a detailed chronology or a detailed medical summary. And a cost projection, not always a chronology, but we do recommend at least a medical summary. And a Medicare set-aside, that's going to depend as well. What we know from CMS is CMS prefers a timeline, some kind of chronology with more focus on the last 2 years of medical treatment. It's really going to depend on the referral source and what your role is in that particular referral. If you're an expert witness, you definitely want some sort of detail, whether it's a chronology or a summary. You need something in your report to be able to support your recommendations of future care. Cost projections as a consultant, those are all over the map. It's really going to depend on the referral source. What kind of turnaround time, what kind of money the referral source is willing to pay. The last thing you want to do is tick off a referral source by billing 10 to 20 hours for a review of records and a chronology, which the referral source doesn't think he or she really needed. So let's talk about chronology versus medical summary. Totally up to you. There's no right or wrong answer whether it should be a chronology or should be a summary. I can tell you what we do at FIG. As an expert witness, we're going to provide a detailed medical chronology or medical timeline in the report, especially as an expert witness. As a consultant, we're not going to provide a detailed chronology. What we will do is highlight the records in a summary or a bullet point format. So what do we include in the chronology or the summary? Good question. If it's a chronology, look at the format as a SOAP note: subjective, objective, assessment, and plan. If it's a summary, you're still going to look at the format as a SOAP note, but it's going to be in paragraph form rather than by each date of the medical record. We don't include every single entry in the chronology. We do include what we consider to be relevant and support for the life care plan, cost projection, or MSA recommendations. What should you not include in your chronology or summary? Don't include information that has nothing to do with the case. For example, any unrelated pre-existing medical conditions. It's different if a pre-existing medical condition is exacerbated, but if it's totally not related, don't include it in the chronology or summary. Even if it's in the medical records, put the relevant past medical history somewhere else in the report. Don't include your opinions or interpretation of any medical records. The chronology and the summary is simply a regurgitation of the records review. Interpretation and opinions are saved for later down in the report. One of the things we do as an expert witness with a life care plan, we tend to highlight or underline relevant information in the chronology or the summary that's going to help us quickly find what we need during a deposition and trial to support our opinions of future care. For example, if Dr. Ortho recommended a total knee replacement on so-and-so date, and that total knee replacement has yet to occur, that's something I'm going to highlight or underline in the chronology. I think the important takeaway here is having a chronology or a summary in all of your reports, especially as an expert witness. How do you support your opinions of future care in your report? We teach a formula called past plus present equals future. Past is the review of records transferred into a chronology or a summary. Present is what's going on today as far as a treatment plan, the assessment, and collaboration with the providers. And then the future are the recommendations of future care and cost, which we include in grids or tables. So how do you support your recommendations of future care and cost? That would be through the past and the present. If you don't include the past, as in the chronology or the summary in your report, then you don't have a basis of supporting the future. This is the way we do it at FIG. This is Shalene Giles saying have a blessed day.